Okay, when are the candidates going to talk about the real problems in our country? The problems that are so big and nobody wants to talk about them anymore. I mean, everybody, candidates turn around and say, well, I'm going to give a tax break here, or I'm going to put a fence up here, or immigrants are bad, immigrants are good, or whatever. Man, that's a fraction of what's really going on in this country now. Look at this. It's really healthcare. Man, that's our biggest problem that nobody wants to talk about. Now, look what's going on here. Okay, and since 1960, okay, now that's when healthcare was just 5% of our entire economy. Okay, 5%, 1960. Okay, now it went up to 18%, 17, 18% of everything we do is paying for health care. That means the average family now, a family of four, is something like $20,000 a year to go to health care. Paying health care. Man, $20,000. I mean, that's incredible. And everybody thinks, oh, we had Obamacare, and people think that solved the problem. It certainly didn't solve the cost problem. Right? Or people think it's turning us into socialists and they want to get rid of it or whatever. Man, the main thing is we're spending money and going in debt because of this stuff. And if that's not the case, man, look at what the federal expenditures on healthcare. Look at this graph. Now, this is done by a conservative organization, the Peterson Foundation, and you see that out in the future, from 2010 to 2050, man, major health programs are the biggest part of the budget. Look, it's twice the Defense Department, almost twice the Social Security, or actually, certainly more than 50% more, and even so, all the discretionary income. Look at non-defense and non-defense discretionary income. So you have defense and non-defense, and that's nothing compared to health care. Other mandatory programs, that's all the other social programs, welfare and all the mandatory food stamps, that's peanuts compared to the healthcare problems, what we're spending on that. But everybody seems to ignore that. Why? I mean, if you were buying, a car or something that's worth $1 gazillion and maybe not worth it, why are you spending that much money? We don't know. We just think it's good, and we keep spending money, and nobody asks the right question. What the hell are we doing that for? So, why do we spend so much? Man, well, look at this. Other countries aren't doing that. Look what we spend per capita. Okay, so that the average person in this country now spends like almost $9,000 a year on healthcare. $9,000 a year on healthcare. That's what we're spending. Okay, the average of all the other developed countries, all the other countries like us, we're not comparing ourselves to Bangladesh or something like that, all the other developed countries, the rich kids, the rich kids in the world, how do they spend, what do they spend on healthcare? Half. They spend half of what we get. So a family of, has to spend $20,000 a year in this country. They're only spending $10,000 per family in other countries. I mean, that's amazing to me. They're spending half. And so if they're spending half, then at least particularly during the debate and the healthcare say, oh, we got the best healthcare in America, in the world, right? Number one, everybody comes here and all that kind of stuff. Well, let's look at that a little more, okay? There's a report that came out of all the fat cats in the country, in the world, I mean, and how well we're doing against all the other fat cats in the world, on healthcare. Okay, are we really number one? Yes, we are actually. We're number one in spending, as I just showed you, spending twice as much as everybody else on an average. But we're also number one in having the shortest life expectancy for men. So if you're a man in this country, you're going to live shorter than any other country. All the other men in all the other countries are living longer than we are. Now, if you were belonging to a club, there were 17 members of this club, and they're all living longer, wouldn't you want to know what the hell they're doing to live longer? Don't you want to live longer? Well, we're number one in the shortest lifespan for men. But listen to this, there's hope here, because we're only number two in the shortest lifespan for women. Hey, we're only number 2, but we're back on top when it comes to infant mortality, kids dying at birth. We're number 1 in the world of all these rich kids in the world. So infant death rates, we're number 1. We're also number 1 in adolescent pregnancy, sexually transmitted infections. So we talk about the number 1 in healthcare in the world. Man, we are number 1 in sexually transmitted disease for adolescents. Or we're number 1 in HIV infections. Yay! Yes, great for us, right? Or how about the number of years, the number of years of life lost because of alcohol or drugs? And this is not because of traffic accidents, but just because you're addicted or something. We're number 1 again. Wow, what a deal. Or how about, this is a great being number 1. We're number 1 in obesity. We're the number 1 country of all these rich kids in obesity. Man, we're keeping on the number 1. How about this? We're number 1 in diabetes. Yay! Boy, number 1 again. Or how about the death rate from coronary disease? No, oh gosh, we're number 2. I'm sorry. Well, here's another number 1 we're at in our inactivity as we get older because of arthritis. Okay, we can't do as many things. We're number 1 in inactivity because of arthritis for our older citizens. Man, isn't it great to be number 1? Why do we get so excited about our healthcare system when we're paying so much? You know, and the outcome, I mean, isn't it like how long you live or how sick you get or this kind of thing? Isn't that how you judge? Not because, you say you're number 1. Are you number 1? It's the data. I mean, that's why, and this isn't un-American. This is like a coach. A coach's not going to tell a team that they're great. Sure, they're great inside, but man, they got to play, man. You got to make people live longer. You got to do this. And why are you spending twice as much as everybody else? Huh? Now that's stupid to me. When you get the same thing, spend twice as much. Here's another thing too about the healthcare system. Man, look, okay, here's the Centers for Disease Control. And the main reasons for dying, okay, the leading causes of death. Number 1 is heart disease. There's like 600,000 people a year die from heart disease. Number 2 is cancer, about $548,000 a year. I mean, 500, not dollars, lives a year die of cancer. Now look at number 3. It's not on this list, but the data show over 200,000 to 400,000 people die a year because of mistakes in hospitals. Right, so we got 200,000 to 400,000 people dying every year. That's the number 3 cause of death, is going to the hospital and them screwing up. Not because you're sick, because they messed up. They killed you. Now, if your automobile was killing $200,000 to $400,000 a year, they'd be taking that off the road, right? If something was wrong with the automobile because it was killing people, we wouldn't be driving around those cars. You'd never see them again. One death and, they're having a recall, the whole thing. When are we going to recall these hospitals? No, we'll pay twice. We're going to pay twice as much. Isn't that fun? Just so we could be number 1 in something, which I'm not even sure. And actually, if you go to that list, accidents and all kinds of things, well, automobiles. I used to think automobiles was the most dangerous thing you do in life. Man, no, only 32,000 deaths a year in automobiles versus 200,000 to 400,000 in the hospital by mistakes in the hospital. These are accidents, incompetence or whatever the heck happens, not because of your disease or the illness or the reason you went there, because the hospital screwed up somewhere. So that's what it is. So what are we doing in this world? Paying a hell lot more for health care. I mean, it just seems silly to me. If you look at the data and you see that we're worst in the world, we live the least longevity of life than all the other developed countries, more kids die at birth than all the other developed countries, and we pay twice as much. Gosh, now if there's a way to make individuals do more with their money, why don't we do that? Everybody's worried, we got to give money out of the taxpayers. Well, actually, what's interesting about Obamacare, now that didn't solve any of those problems. The only problem it worked on, in my mind, is that got people to get covered in insurance that weren't covered. what happened is they went from like, we had, I think, about 40 million people did not have insurance before Obamacare, and we're down to about 32 million. So that shrunk. So we're getting that down a little bit. So I mean, that's almost immoral, I think, to have a country where people don't have insurance, so they can't take care of themselves. I know personal stories. They didn't have insurance, so they didn't find out about something, and they died prematurely because they didn't have insurance. I mean, that seems like a moral obligation, to all of us. So that's why, to me, at least Obamacare did that. Did nothing about the big problem of money. I mean, just think if we paid half, like all the other countries do, we'd have enough money to pay everybody for full insurance. And if you look at what the other countries, how much of their insured, nobody in that list of 17, has less than 99.9% coverage. So they're paying half what we have. 100% of their people have health insurance, and they're living longer and having less diseases and less other medical problems. Wow! Isn't that telling you something about what's going on in the world? And everybody argues about spending $1 million here, $1 million there. Man, this is 20% of the GDP. Why aren't we worrying about that? Because it's twice as much as anybody else. You have to compare yourself to everything. You can't fool yourself that you're the best because you call yourself the best. How do we compare to other people? Why are these people doing it? I don't know the right answer, but boy, it seems like that's the problem we have to work on. And when I look at that data, we are the only country that's paying so much for private health insurance. Nobody else does. So maybe that's a clue. That may be a clue. Like I say, we got to work on this problem, not ignore it. Everybody says, "Oh, we can't do this because all the government does is bad, and then all the pharmaceutical companies are bad," and that's stupid. We got to fix this problem of spending twice as much on healthcare and getting shittier results than anybody else in the world.